I know there have been people asking me whether or not I look at PCR specifically. I don't really personally, because I think with PCR that tells us whether or not there's like an active viral load in the body, but for the most part, I can get a sense of whether or not your immune system is struggling from the serology itself. And full disclosure, there's a lot of controversy revolving around reactivated EBV and looking at the serology versus looking at the PCR. In my clinical practice, I tend to see a lot of fringe cases. So from my perspective, I think just weighing the pros and the cons with the people who have not been able to find any cause for their chronic fatigue, fibromyalgia symptoms, or neurological symptoms. Very oftentimes, if we take an approach that hits EBV in a certain way, so using antiviral herbs or using anti-inflammatory herbs that are neuroprotective, many times I do see like clinical improvement in their symptoms. So for me, it's really a pros and cons discussion with the patient on like what they're willing to try, what they're willing to look into, what they've already been worked up for, and what makes the most sense in their care.